Hi, Talia. This is our first discussion here. We're trying this new series of, sort of patient stories, I'm going to call these, I think. Basically, I wanted, you're one of my patients, and we're going to get to the kind of things that have gone on with you. But, let's start by just tell me a little bit about what your life was like with regard to your headaches before we met.
So before we met, it started in about 2010. And by then I was a medical mystery. My doctors had grown up their arms, and it took about 4 or 5 years to truly get a diagnosis and a doctor who understood my symptoms. So I was working with a neurologist and pain management doctor who understood my symptoms, but then it was finding a treatment. And so I always had an average daily pain before I got a treatment plan of about 7. Once I got a treatment plan, it went down to about a 3. But I didn't respond to medication. So we quickly shifted onto nerve blocks, which really reduced my pain. But as soon as we went on nerve blocks, that's when my neurologist told me, the time is going to come, I'm going to need surgery. So I went from having an average daily pain of about 7 down to about 3. But the flares were still coming fast and furious, at least once a month. Flares were usually 7 to a 9. I was in the hospital at least once a year in the ER. And slowly that took a toll on my body. I could start doing less and less and less. First, it was my social life that went away. And I'm not a real active person, but I do like to go out with my friends, have a cup of coffee, get some dinner, catch up. That stuff. Then I had to start scaling back on my hours at work. I'm a lawyer. I have to work long hours sometimes, depending on my court schedule. And it went from working as much as possible, from 60, sometimes 80 hours a week, to I was barely doing 40 hours a week. I was out sick at least twice a month. And finally, it just took too much of a toll on me. I was lying in bed on a heating pad every evening after work. And then my housework started to suffer. I couldn't do basic stuff around the house. I couldn't take care of things. I was sending out for my laundry to be done. I was sending out for my meals to be delivered. And that's when I realized the quality of life was just too diminished. And it was time for surgery. Around then, that's when my neurologist was recommending I shouldn't get nerve blocks anymore and to look into the surgery. So I looked into the surgery. In about 2018, I started researching surgeons. By 2019, I had made the decision, it's time to get surgery, time to pick a surgeon. And so I reached out to you in spring of last year and started the process.
Right. So, thanks for sharing all that. And it's obviously it's almost classic in terms of how debilitating these headaches are. People think, oh, it's just a headache, or it's a 3, it's not that bad. I mean, I think these are kind of unfair value judgments that certainly practitioners don't really have a right to place on anyone. I say that to my patients all the time. Only you can decide when it's enough. And I think that's one of the important points that you make that I want to underscore. It's, when you have reached a point where that this has done too much in a negative way to your life, then it's appropriate when all other things have failed, and as they did with you, to seek out surgery. And I think that, it also illustrates your case, the fact that, if I recall correctly, you were never without some type of discomfort. So you have pain 24/7, and forget working. I couldn't operate if I had that kind of pain 24/7. But that's just one kind of cognitive focus that you need. Being a lawyer, I'm sure there's complicated legal matters you're considering routinely, and that would be hard enough. But I have a family, as many people do, and friends that I want to see, and I just would not be able to do those things. So, all right. So we first saw you in November. We operated on 3 nerves in the back of your head and a couple over the eye. And so now you're almost 7 months, 6.5 months or so after the operation. How are you doing?
I got my life back. So when you did the diagnostic nerve block, it was the first time in basically 10 years I hadn't had pain. I was staying with a family friend who's a retired doctor, and he was just amazed at how improved I was. So for about 36 hours, I had no pain. Thankfully, I only had to wait a few more days to surgery, and I came out of surgery with surgical pain, but no nerve pain. And that's continued to this day. I have a minor twinge in my eye that comes and goes. I wouldn't even call it pain, kind of just a little flicker in the eye. I'm monitoring it, but it doesn't really bother me. Don't need any medicine. And I was looking into fitness classes, which I haven't been able to do in 10 years, before COVID. Now, because of COVID, I can't do that.
Right.
I was starting to see my friends. I had a glass of wine. I haven't had a glass of wine in probably 5-6 years, because that was a flare for me. But I had my first glass of wine a few months ago, and it's just nice to be able to do the basic things like see your friends, clean your house, go to work, not be in bed all day. In fact, I realized recently over the weekends, I thought, why do I have all this time? I said, I'm not lying in bed.
Yeah.
And that is everything to someone who's been in pain for years.
Right. Right. Yeah. And I think, you point out it's really all those little things, just the ability to do X, Y, or Z. If you've ever had anyone that has been sick, much less chronically sick, you notice and really get an appreciation for those kinds of things. So, and I think for me, that's the most important aspect. I mean, clearly you're back to work, and your profession is obviously something you care passionately about and is important to you, not just something you do. And so that's important, but, just those day-to-day things, I think are, you just really learn to appreciate them more. I think with regard to COVID, people know now just being able to see your friends, which is they've taken for granted in the past, is really just a true joy. And so, it's, and to be honest, and I want to thank you for this, that like hearing this kind of thing from my patients on a fairly routine basis is really the best thing ever, and that's why you go to medical school and try to become a doctor. So listen, I'd like to give you the floor, so to speak, if you have any final thoughts, but preemptively want to thank you for sharing your story, and
Absolutely.
so glad obviously that you've done so well.
So I would just say, if you're in pain, and whether it's for trauma or for me, where it was no one knew what it was, there's help. And people have different outcomes. I have friends who haven't done as well with the surgery as I have, but look into it. There are resources out there. For me, it was some support groups on Facebook, and look into the surgery, because really, there are some great surgeons out there. Of course, I'm a big fan of Dr. Pellet, but I know there are other surgeons out there. And those of us who have been through it are usually willing to help and share our experiences, because this is kind of a rare condition, and treatment is kind of particularized. But there is help, there is relief, and you can get your life back.
Yeah. All right. Really powerful messages. Thank you so much for taking the time. I really appreciate it.
Thank you, Dr. Pellet.
All right. Take care, Talia.
Thanks, Dr. Pellet.